So I had a client tell me that she was told she could take apple cider vinegar to get rid of her preeclampsia because she had already had her baby. So the first thing about this is we're not going to mess around with preeclampsia. So let me explain to you what happens. I want you to picture for a minute, this is your cute little baby that you're trying to get to, okay? And you have blood vessels, specifically in the placenta, and they water and they nourish the baby, right? And we're going along about our business and we're doing great. Pregnancy's going fine. And then all of a sudden, preeclampsia comes in. And so what essentially happens is those blood vessels, they get tight and they get constricted. And then all of a sudden, my baby is not getting what my baby needs. So now my baby is only getting this. So yes, it is true that preeclampsia does affect your baby, but it also affects your vital organs. Let me explain. It's not only affecting the blood vessels in the placenta, it is also affecting the blood vessels in the rest of your body. So what happens is your blood vessels get tight and they get constricted like that. And so what your body says is, wait a minute, I still need to get blood to vital organs. So what am I going to do? I'm going to crank up the pressure. And I'm going to crank and crank and crank because I'm still trying to get blood flow through these vessels that are now constricted and tight. So what ends up happening is the pressure builds and builds and builds in those blood vessels, and eventually it creates these little micro tears. And fluid is leaking where the fluid should not be leaking. So now you wake up one morning, you're 20 to 30 pounds heavier because you have swelling. That's preeclampsia. You have swelling in and around your liver. You have this right upper quadrant belly pain, okay? You have pressure buildup and swelling behind your eyes. So now you're having blurry vision. You have swelling and fluid buildup in your head, and you also have these constricted blood vessels in your head. So now you're having a really bad headache. What eventually can happen is the pressure will continue to build. The tears will continue to happen in your blood vessels. And if this happens in your head and around your brain, then now you have bleeding around your brain, which can lead to a stroke. And this can happen up to 6 weeks postpartum. This is the reason why you can still have preeclampsia after you have your baby. It might take a little bit of time for your body to repair itself from all of this damage that has happened. We are not going to mess around with preeclampsia. So if you are having any of these signs or any of these symptoms, you are going to reach out to a medical professional. You are not going to reach out to a doula for this. You are going to either reach out to your doctor or you are going to reach out to your midwife.